Assalamualaikum and good day to all. My name is ZANARIAH and I will be presenting my research on arterial spleen labeling, cerebral blood flow imaging to define reperfusion after acute ischemic stroke. Circulation of blood in brain is very important to ensure the physiological function of the brain works normally. In ischemic stroke, the cerebral blood vessel may be occluded by blood clot. Reperfusion and recanalization of the occluded blood vessel is needed to prevent from cerebral tissue death. There are three fates of occluded vessels after few hours of stroke onset. First, there will be a persistent occlusion of the blood vessels and results in poor tissue reperfusion. Second, the occluded blood vessel is recanalized, but the blood flow may not flow to the distal blood vessels and cause poor tissue perfusion. Lastly, the occluded blood vessel is recanalized and the cerebral blood flow can flow to the distal blood vessels and results in good tissue outcome. Arterial spleen labeling, or ESL, allows non-invasive quantification of cerebral blood flow without contrast administration and may offer a tool to define reperfusion. In this study, we aim to quantify the reperfusion of cerebral blood flow in ischemic stroke patients 48 to 72 hours after stroke onset. ESL uses the blood as endotraces. The cerebral blood flow will be inverted 180 degrees using the radio frequency pulse. This process is called labeling. Next, a control image is acquired without the RF pulse. The difference between the magnetization of blood in label and control image will produce the ESL image. The radiological images collected in this study were retrieved from a single-center pilot observational study with the following inclusion and exclusion criteria. Standard acute stroke CT protocols were conducted during the first 24 hours of stroke onset. The ESL scans, along with other MRI stroke protocols, were conducted during the follow-up visit. The functional outcome assessment quantified the modified ranking scale, or the MRS, were conducted on day 90 after stroke onset. This is the ESL image processing pipeline. The image processing was conducted using Basic software. The pipeline includes realignment of the ESL images and image co-registration to the MRI structural image. Basic also can measure the gray and white matter of cerebral blood flow. To quantify the reperfusion of the cerebral blood flow, a reperfusion index was measured. The reperfusion index was the ratio between the difference of hypoperfusion region during the baseline and the follow-up. A reperfusion index of more than 0 is considered as reperfused, while reperfusion index of less than 0 indicates no reperfusion occurred. This is the demographic results of the study. 75% of the patients were male and the mean age was 68 years old. The severity of stroke during the admission was 6 as indicated by the NIHSS score and reduced to 1 at the 24 hours after the stroke onset. 85% of the patients had good functional outcome at day 90 after stroke onset. The mean cerebral blood flow at gray matter was 49 ml per 100 gram per minute, while 16 ml per 100 gram per minute in the white matter. This is the results for a patient who has an occlusion at the right proximal middle cerebral artery as indicated in CTA and delayed in Tmax in CTP. During the follow-up assessment, the blood vessels were completely recanalized as indicated by the MRA, and the area of hyperfusion ESL confirmed it. The reperfusion index for this case is 0.77 and the patient has good functional outcome during the 90 days after stroke onset. This is an example of patients who has occlusion at the right posterior cerebral artery as indicated in CTA and delayed in Tmax in CTP. During the follow-up assessment, the blood vessels were incompletely canalized as visualized by the MRA, and there were poor tissue reperfusion at the area as visualized in ES-Star map. The reperfusion index for this case is 0.33 and the patient has poor functional outcome during 90 days after stroke. As a conclusion, ESL is able to provide a quantitative measurement of cerebral blood flow perfusion without the need of exogenous contrast agent in ischemic stroke. The perfusion index is a useful measurement to quantify the reperfusion of cerebral blood flow in acute stroke patients. Thank you.